We go now to our reporter Laura Windsor, who's with fertility expert Dr. Sami David, talking about his book, Making Babies.
1 in 8 couples has trouble conceiving or maintaining a pregnancy. When a woman is over 35, 1 in 3 couples will have infertility issues. We spoke with Dr. Sami David, a world-leading reproductive endocrinologist who helps couples with infertility problems. We asked him to tell us about his book, Making Babies.
In my book that I published, Making Babies, a proven 3-month program for maximum fertility, I go through various tests and lists that ought to be done for a patient. And categories are anatomical testing, testing for infections, testing for hormones, testing for immunological factors, testing for environmental factors and dietary factors. So we start out with a complete history of the patient, both husband and wife. For example, are they getting pregnant and having early miscarriages? Are they really having infertility? You ask them about symptoms before their periods. Are the breasts very tender before some periods more than others? That indicates to you that the woman is not infertile but having early pregnancy loss. You ask them about their history of pregnancy. All right, and then in terms of testing, I do a test that's I think is still worth doing, which is a postcoital exam, which is examining the woman after intercourse to see if the sperm is there, number one, and see if the sperm are alive or dead. Then I test another one of the lists would be looking for bacteria, specifically routine bacteria, mycoplasma, and ureaplasma. Very common organisms that can cause either infertility or many pregnancy losses. Next step for the woman then is also to check her hormones, her thyroid hormone, her prolactin hormone, and progesterone hormones. The progesterone is the most important hormone to sustain a pregnancy. Having done those tests, then the next step for the woman is an x-ray of her uterus and tubes. But it tells me whether she has abnormalities in her uterus, things like polyps, fibroids. It tells me that her fallopian tubes are healthy. On the part of the husband, once again, a very, very thorough history. Does a man take tub baths or jacuzzis? Does he put a laptop computer on his lap that heats up his testicles? Does he drive a car with heated car seats? Where does he keep his cell phone? All right? These are cute studies, cute questions, but guess what? They can accumulate and cause issues with the sperm. Then for him, he gets the sperm analysis, which measures the numbers of sperm, the motility, but most important, the shapes of the sperm. Extremely important. Okay? And then I also do cultures on the man's sperm. Is there minor bacteria there? Is there something that I can make them more fertile by giving them any antibiotics? So that's the list. But in the history taking, you'll suddenly find maybe there is a problem that can be solved very, very easily just by lifestyle changes. About 20% of my new patients are calling in from other states and other countries. Last week, a woman from Dubai called up, and I had a 1-hour consultation with her, 27 years old, being told that you have unexplained infertility. And I reviewed the records, and I said, but this, and this test has not been done yet. You don't have unexplained infertility. Same with couples from Los Angeles and California and state of Washington. I have a patient from Colorado. One of the longest patients I've had, actually she did fly in, was from Korea, South Korea, and she had 2 children, 2 miscarriages, then 2 years of infertility. And the doctors in Korea had no idea what was going on. She had one of these bacteria called ureaplasma. I treated the husband and wife with antibiotics for 2 weeks, and she had a baby boy 10 months later.
Dr. David gives his best advice for these couples.
Look at the evaluation you've had, ask the doctor to go further into it, go in depth, and perhaps find a medical problem that should actually be addressed, causing the infertility, rather than, oh, we'll just make you pregnant by giving you drugs.
More than 9 million American women seek treatment for fertility issues each year, and according to Dr. Sami David, the Making Babies program is designed to prepare your body for a healthy and natural conception. For the American Health Journal, I'm Laura Windsor.